Bedsores, pressure ulcers. Bedsores, also called pressure ulcers and decubitus ulcers, damage to the skin and subcutaneous tissue due to prolonged pressure on the skin. Bedsores usually grow on the skin covering the skeletal areas of the body, such as the heels, ankles, buttocks and tailbone. People who are at high risk of developing sleep disorders have health conditions that limit their ability to change positions or make them spend most of their time in bed or in a chair. Bedsores can grow over hours or days. Most wounds are treatable, but some do not heal completely. You can take steps to help prevent bedbugs and help them recover. Symptoms. Warning signs of sleep sores or depression sores are unusual changes in skin color or texture, inflammation, pus-like discharge. The area of the skin feels cooler or warmer when you touch than other areas. Tender areas. Bedsores fall into one of several categories depending on their depth, sharpness and other characteristics. The degree of damage to the skin and tissues ranges from red, non-cracked skin to serious injuries involving muscles and bones. Common areas of pressure ulcers for people who use wheelchairs. Bedsores often appear on the skin at the following sites: tail or buttocks, shoulders and shoulders behind the arms and legs where they rest in a chair. For people who need to stay in bed, bedsores may be the back or sides of the head, shoulders, hip, lower back or tailbone, heels, ankles and skin behind the knees. When to see a doctor. If you notice warning signs of bedsore, change your position to reduce pressure in the area. If you do not see well in 24 to 48 hours, consult your doctor. Seek immediate medical attention if you show signs of infection, such as a cold, watery discharge, a foul-smelling sore, or a cold redness, warmth or swelling of the wound. Causes. Bedsores are caused by pressure on the skin that prevents blood from flowing to the skin. Limited movement can put the skin at risk of injury and lead to the formation of bedsores. The three main factors that contribute to bedsores are pressure. Continued pressure on any part of your body can reduce blood flow to the muscles. Blood flow is important for the delivery of oxygen and other nutrients to the muscles. Without these vital nutrients, the skin and tissues around them are damaged and may eventually die. In people with limited mobility, this type of stress usually occurs in areas where there is a lack of muscle or fat and lying on the bone, such as the spine, tail, shoulder blades, hips, heels, and elbows. Conflict. The rash occurs when the skin is rubbed against clothing or bedding. It can put vulnerable skin at risk, especially if the skin is also wet. Hit. Shear occurs when two areas move in the opposite direction. For example, when the bed is raised on the head, you can slide on the bed. As the tail goes down, the skin on the bone can remain intact, actually pulling on the other side. Risk factors. Your risk of sleep apnea is higher if you have difficulty walking and can easily change position while sitting or sleeping. Risk factors include inability to walk. This may be due to poor health, spinal cord injuries, and other causes. Lack of self-control. The skin becomes more vulnerable to extended exposure to urine and stools. Lack of sensory perception. Spinal cord injury, nervousness, and other conditions can lead to loss of sensation. Failure to feel pain or discomfort may result in you not being aware of the warning signs and the need to change position. Malnutrition and hydration. People need enough fluids, calories, proteins, vitamins and minerals in their daily diet to maintain healthy skin and prevent tissue decay. Medical conditions affecting blood flow. Health problems that can affect blood flow, such as diabetes and arthritis, can increase the risk of tissue damage such as sleep sores. Problems. Complications of pressure ulcers, some life-threatening, include cellulitis. Cellulitis is an infection of the skin and soft tissues connected. It can cause warmth, redness and swelling of the affected area. People with nerve damage are less likely to experience pain in the area affected by cellulitis. Infection of bones and joints. Infections from depression can affect the joints and bones. Joint infection, septic arthritis, can damage the cartilage and tissues. Osteoporosis, osteomyelitis, can reduce the function of the joints. Cancer. Prolonged, non-healing wounds, marginal ulcers, can develop into a form of squamous cell carcinoma. Sepsis. Often, a skin ulcer leads to sepsis. Prevention. You can help prevent sleep sores by repositioning them to prevent stress on the skin. Other strategies include taking good care of your skin, maintaining a healthy diet and eating fluids, quitting smoking, controlling stress and exercising daily. Reset tips: consider the following recommendations regarding bed or chair placement. Shift your weight regularly. Ask for help with resetting about once an hour. Raise yourself up, if possible. If you have enough strength in the upper body, do wheelchair push-ups. Lift your body up from the chair by pressing the arms of the chair. Look for a special wheelchair. Some wheelchairs allow you to lean forward, which can reduce pressure. Choose cushions or a mattress that relieves stress. Use special cushions or mattresses to reduce stress and help ensure your body is in good shape. Do not use donish, as it may focus on pressure on the surrounding tissues. Adjust the height of your bed. If your bed is not raised on the head, do not raise it more than 30 degrees. This helps prevent shaving. Skincare tips: consider the following suggestions for skincare. Keep skin clean and dry. Wash skin with a gentle cleanser and dry. Perform this cleansing procedure to reduce skin exposure to moisture, urine, and stool. Protect the skin. Use moisturizing creams to protect the skin from urine and stool. Change bedding and blankets as often as needed. Look for dressing buttons and wrinkles on the bed that irritate the skin. Examine the skin daily. Carefully check your skin daily for signs of stress.